Welcome to Friday. Beautiful shot there of downtown Vancouver, approaching 7:46 right now. And as we've been telling you in news, the provincial government spending $36 million over the next 3 years to double the amount of treatment beds to help struggling youth with opioid addictions here in the province. Let's go right now to Kelowna and bring in Celine Thompson, the executive director of The Bridge. Celine, welcome to BT. And this is something that you deal with every day in your line of work.
Absolutely.
So tell us your reaction to the news yesterday when this came out.
It was pretty emotional. We were pretty excited. We've been lobbying really hard to get a better system of recovery and addictions care for young people, particularly those under the age of 19, for at least 4 years now. So to see this level of investment and this ownership of mental health and addiction services for young people was extraordinary.
Is there any concern that we have to wait for 3 years? I assume there's an immediate need for resources and services right now for your community and for people struggling, especially youth, with addiction issues in the province.
Yeah, and I didn't read it as waiting. I suspect that for some communities, it would take 3 or 4 years to develop a plan and a facility. I suspect, though, recognizing exactly that, the urgency, that if people have ready-made plans and can move out quicker, I presume that there's going to be resources that they can access. I certainly hope so.
Tell us about the work that is done at the Bridge in Kelowna in terms of giving families and youth who are struggling with addiction support and resources.
Well, we've worked with young people and families, particularly those that are the most vulnerable in our community, for about 50 years now. And our services cover the gamut of family counseling, mental health support, youth outreach. We also run a youth withdrawal management services or youth detox. And we're the largest provider of adult recovery and addiction services for the Interior Health Region. So pretty broad scope.
And when we look at the drug supply that is becoming increasingly toxic in certain parts of the province, especially down in the downtown east side here in Vancouver, how do we sort of address that issue as well?
Well, I don't think that anything responding to the current crisis can be a one-pillar approach. The youth recovery spaces are going to be so significant. Early intervention is key, but we can't leave we have to continue to do all of our efforts on harm reduction and trying to work towards safe supply as well. It can't be just a single lane in. We're going to have to pull out all the stops. And I think that's what we're starting to see from the provincial government, which is really exciting.
And can you talk about the opioid problem in Kelowna specifically?
It's hit us here just as hard as it's hit everywhere else. I think where we're really disadvantaged here is that we don't have the local resources. Our young people need to wait oftentimes in excess of a year to access treatment spaces available in Vancouver and Prince George. That also means that when they are getting their health needs met, they're getting their health needs met outside of the communities and families who raise them and love them. It doesn't give us the best health outcomes. They need to get their health needs met locally.
All right, Celine, thank you so much for your time this morning, and keep up the great work.
Oh, thanks so much for having me. Good morning.
Of course. Yeah, you take care. That's Celine Thompson, Executive Director of The Bridge in Kelowna. Coming up.